Hi, my name is Roxanne and I'm a physical therapist with PT Health Academy. Have you ever heard of intermittent lumbar traction? This can be a great strategy to help prevent or relieve low back pain. By applying a traction force to your spine, you're unloading the structures in your back that may be a little irritated from the pressure of being upright all day. The other thing that applying a traction force does to your spine is it helps create a vacuum in some of the structures like your cartilage and your discs. And that vacuum helps to suck in blood flow and nourishment to those structures, and that can be really helpful. I will caution you that if you have a shoulder problem or if you have any hardware in your spine from a previous surgery, this would not be a technique that you should do. There are lots of ways to apply intermittent lumbar traction, but I'm going to show you my favorite. I like this pull-up bar. It fits me perfect. I'm 5'4", and as I reach up, it hits my wrists, which is right about the right height for something to hang from. I'm going to grab wide, stand wide, and then I'm going to unlock my knees and just hang for 3 to 5 seconds. And then I'm going to come back up. And I'm going to do that 8 to 10 times. Now I've worked up to 8 to 10 reps, and that doesn't bother my arms at all. But if you're not used to hanging from your arms or working overhead, you might want to just start with like 3 to 5 reps and see how your arms tolerate it. Initially, you'll be limited by what your arms can tolerate as opposed to what your back really wants. You can test to see if this is good medicine for you in 2 ways. First, do kind of a pain assessment of yourself. Let's say I'm a 4 out of 10 pain today, and then I go and hang, and that 4 goes down to a 2. That means that was pretty good medicine for me. The other test you can do is a little range of motion assessment. I'm not a big fan of people bending over and touching their toes, so I tend to test side bend or a little bit of gentle extension. And if that's irritable to you, then you can go and do that traction and then retest your range of motion and see if that feels better or you're able to go much further. Thank you for listening. Feel free to check out my website, pthealthacademy.com. It has my upcoming workshop schedule and also other tips and tricks that you might find helpful. Thank you.